A pharmacy residency is a postgraduate program that prepares pharmacists for clinical practice by providing experience in patient care and research. It helps build specialized skills and deepen clinical knowledge in a healthcare setting. In part 1 of this video series, we explore 19 pharmacy residency interview questions and answers. Each answer can be customized to highlight your unique qualifications and experiences. Before your interview, take time to research the residency program and review its focus areas so you can align your responses with the skills and values they prioritize. Don't forget to watch part 2 of this series. I have posted the link in the description below. Question number 1. What made you interested in this program? Interviewers want to know if you've done your research and understand what makes their program unique. They're looking to see how your goals align with what they offer and whether you've thought through how you'll grow under their mentorship. A thoughtful answer shows commitment, clarity, and genuine interest in their setting, patient population, or preceptor strengths. What drew me to this program was the balance between strong clinical training and a supportive teaching environment. I really like how your residents rotate through a wide range of specialties, and I was especially interested in the ambulatory care and internal medicine components. During my clinical rotations, I found myself most engaged when I was part of a team that worked closely with patients and providers to solve complex problems. And this program seems to foster exactly that kind of collaborative care. I also appreciated how many of your preceptors are board certified in multiple areas and involved in research or professional organizations. It's clear this is a place that values growth and high standards. I'm looking for a program where I'll be challenged but also encouraged, and where I can build a foundation that supports future clinical and teaching roles. This just feels like a good fit in terms of both culture and opportunity. Question number 2. What made you want to do a residency? They want to understand your motivation and career trajectory. This question shows how serious you are about expanding your clinical skills and contributing to a team. They're looking for people who are eager to learn, open to feedback, and ready to take on responsibility in a structured environment. I decided to pursue a residency because I want to become a confident, well-rounded clinical pharmacist, and I know that kind of development doesn't happen overnight. During my fourth-year rotations, I really saw the difference between pharmacists who had done residencies and those who hadn't. Their clinical judgment, communication with providers, and ability to manage complex cases stood out to me. I'm drawn to environments where I'm pushed to think critically, get involved with patient care, and contribute to a healthcare team. I enjoy being part of multidisciplinary rounds and using my drug knowledge to solve real-world problems, but I know there's more for me to learn. A residency gives me the structure and mentorship to do that in a focused way. It's not just about learning more, it's about preparing to be someone patients and providers can rely on in any situation. Question number 3. Tell me about yourself. This question gives interviewers a quick snapshot of who you are. They're not looking for your whole resume. They want a summary of what drives you, what you bring to the table, and what you're aiming for. A strong answer sets the tone for the rest of the interview. Before we continue, don't forget to customize this answer with your own educational background, experience, and qualifications. I'm originally from North Carolina, and I recently completed my PharmD at UNC. I've always enjoyed science and problem solving, but what pulled me toward pharmacy was the opportunity to work directly with patients while being a medication expert. During school, I found myself really engaged during clinical rotations, especially in internal medicine and ambulatory care. One experience that stood out was working with a pharmacist who managed diabetes clinics. Watching the impact she made on patients' lives inspired me to want that kind of role one day. I'm especially interested in a residency because I want to keep building my clinical confidence, work closely with a healthcare team, and learn how to manage complex therapy plans. Long-term, I'm aiming for a clinical pharmacist role where I can precept students and stay involved in education too. Outside of pharmacy, I enjoy cooking and long-distance running. It keeps me grounded and focused. Question number 4. What drove you to the profession of pharmacy? This question helps the interviewer understand your core motivation and how well you understand the role. They want to hear something personal, but also professional. Something that connects your background with the work you want to do. A sincere answer shows passion and staying power. My interest in pharmacy started when a close family member had a medication error that caused a serious complication. Seeing how a pharmacist stepped in to correct the issue and explain what went wrong really stuck with me. It made me realize how vital pharmacists are, not just in filling prescriptions, but in protecting patients and educating families. As I learned more, I was drawn to the balance of science, patient care, and problem solving that pharmacy offers. I enjoy digging into pharmacology and figuring out how to personalize treatment based on someone's full clinical picture. During school, every time I got to work with a team and contribute to care decisions, it reinforced that I chose the right path. Pharmacy is such a dynamic field, and I like that it keeps evolving. I'm excited to be part of that and to keep learning every step of the way. Question number 5. Tell me about a time you impacted a patient's healthcare. Interviewers want to hear about real-life application. This question shows how you think critically, communicate with others, and take initiative. They want proof that you've already had moments where your judgment or care made a difference. During one of my internal medicine rotations, I was reviewing a patient's chart and noticed they were on both an ACE inhibitor and an ARB. Their labs showed rising creatinine and potassium, which raised a red flag. I brought it up to the preceptor and the team during rounds, and we discussed it with the attending physician. Turns out the ARB had been added during a recent hospital admission and wasn't removed when the patient was discharged. We discontinued the duplicate therapy and monitored the patient's labs over the next couple of days, and their renal function stabilized. It was a simple intervention, but it really drove home how important it is to review medications carefully and speak up when something doesn't look right. That moment showed me how pharmacists protect patients, often behind the scenes, and how our attention to detail can prevent serious harm. Question number 6. What is your biggest strength? Describe how it will help you with the residency. This question helps the selection committee evaluate how your personal qualities align with the demands of a residency program. They want to see if your strengths will support you through long hours, patient care, collaboration, and continuous learning. It also shows how well you understand what's needed to thrive in a high-pressure, team-based environment. My biggest strength is my ability to stay calm and focused under pressure. During my APP rotations, especially in the ICU, I often had to process a lot of information quickly while still paying close attention to dosing, labs, and medication changes. I found that when the pressure increased, I became more focused rather than overwhelmed. That mindset helped me not only complete tasks efficiently, but also stay level-headed when communicating with providers or patients. I believe this strength will help me during residency when there are competing priorities, time-sensitive decisions, and the need to adapt on the spot. I know this year will be demanding, but I see that as a positive challenge. Being able to stay steady under pressure gives me room to learn without becoming discouraged, and I think it will allow me to be a dependable team member, even in fast-moving clinical environments. Question number 7. What are some of your weaknesses? Describe how different aspects of the program will help you work on this weakness. Interviewers ask this to assess your self-awareness and growth mindset. They know no one is perfect, so they're more interested in how you reflect and take action to improve. It also shows how well you've considered how the residency structure can help you develop into a more well-rounded pharmacist. One area I've been working on is clinical confidence, especially when it comes to making recommendations in front of larger interprofessional teams. I've had moments where I second-guessed myself even when I had done the right research and preparation. I've improved by seeking feedback and putting myself in situations where I have to speak up, like case presentations and topic discussions. I think the layered learning model and mentorship in this residency will give me more chances to grow in that area. Getting regular feedback from preceptors and being pushed to think independently will help me trust my judgment more. I want to get to a point where I can confidently contribute to rounds without hesitation while still being open to correction. The structure of the program seems like a great place for me to continue developing that skill in a supportive way. Question number 8. Tell me about the hardest job you have had to perform. This question gives insight into your resilience and adaptability. Residency is challenging, so hiring managers want to know how you've handled demanding roles in the past. It also helps them see how you stay motivated when things get tough or repetitive. The hardest job I've had was during pharmacy school, working weekends at a retail pharmacy while balancing APPEs and schoolwork. The pace was intense, and I often had to juggle difficult customer interactions while still making sure everything was accurate and safe. There were days when we were short-staffed and the lines were long, but I stayed focused by prioritizing patient care and staying organized. It taught me a lot about communication, especially how to stay calm when people are frustrated or upset. I also learned how to manage my time down to the minute, which came in handy during my clinical rotations. That experience reminded me why I want to be in a more clinical, patient-centered role, where I can spend more time on therapy decisions and collaborative care. It was tough, but it pushed me to grow, and I know the skills I gained will carry over into residency. Question number 9. Tell me about a time you did work you didn't find valuable and how you dealt with this. Residency includes administrative tasks, documentation, and repetition. This question helps assess whether you can stay engaged even when the task isn't exciting. They're also checking your ability to find purpose and maintain professionalism regardless of how meaningful the task feels. During one of my rotations, I was assigned to track patient vaccination records daily. At first, it felt like busy work. I didn't see the clinical value right away, but after asking more questions, I realized the reports were part of a quality improvement initiative tied to reimbursement and patient follow-up. That changed my perspective. I started reviewing the data more closely and noticed patterns that helped the team identify patients who were overdue for vaccines. I even suggested a small update to the spreadsheet format to make it easier to track missed opportunities. Even though it wasn't the most exciting task, it taught me that value isn't always obvious up front. Sometimes the work we do supports bigger outcomes we don't immediately see. That shift in mindset has helped me approach similar tasks with more curiosity and patience. Question number 10. What was your least favorite rotation and why? This question reveals your preferences and how you approach less than ideal situations. The goal isn't to see what you disliked, but how you handled it. Interviewers want to see if you stayed open-minded, made the most of it, and still learned something valuable. My least favorite rotation was my community rotation. While I respect the role of retail pharmacists, I realized I'm more drawn to clinical settings where I can work closely with interdisciplinary teams and contribute to medication management beyond dispensing. That said, I still made the most of the experience. I focused on improving my patient counseling skills, especially with patients managing chronic conditions like hypertension and diabetes. I also took the opportunity to get more comfortable with immunizations and medication therapy management. What I learned is that every setting has its own challenges and value. Even though it wasn't my preferred area, I took away transferable skills that apply to hospital and ambulatory care too, like communication, time management, and building rapport with patients. I think it's important to stay open to learning in every environment. Question number 11. Tell me about a time when your carefully laid plans were fouled up. How did you react? What happened? Residency comes with unpredictable schedules and unexpected shifts. Hiring managers want to see how you respond when things don't go as planned. Your reaction to change shows your resilience, emotional intelligence, and adaptability. During one of my rotations, I was scheduled to present a therapeutic topic to the preceptors and students at the end of the week. I spent hours preparing a detailed slide deck and practicing my timing. On the day of the presentation, the entire pharmacy team was pulled into a last-minute formulary review meeting, and my presentation was postponed by a week. At first, I was frustrated. I'd worked hard and mentally prepared to be done, but I took a breath and used the extra time to polish my presentation even more. I reviewed updated guidelines, added a clinical case example, and practiced with a classmate who gave great feedback. When I finally presented, it was smoother and more interactive than I expected. Looking back, that unexpected delay gave me the chance to make it better. I've learned that in pharmacy, things won't always run on schedule. I try to stay flexible and use those shifts as opportunities, not setbacks. Question number 12. Describe how you scheduled your time on an unusually hectic day. Give a specific example. This question helps residency directors understand how you manage your time and prioritize tasks under pressure. Residency days can be unpredictable and packed, so they want someone who can stay calm, flexible, and focused. Your answer should show how you organize, communicate, and stay efficient without sacrificing quality of care. During my internal medicine rotation, I had a day when rounds ran late, consults piled up, and I had to present a patient case by 3 p.m. I knew I needed to be strategic with my time, so I paused after rounds, made a prioritized checklist, and grouped tasks by urgency and location. I handled the most time-sensitive consults first, flagged key labs, and called providers for quick clarifications rather than waiting on email replies. While prepping my case, I minimized distractions and blocked off 30 minutes to rehearse and organize my notes. I also let my preceptor know early on that I might need to adjust my delivery time by 15 minutes, which they appreciated. That day taught me how valuable it is to pause, plan, and communicate clearly. Even when things feel chaotic, taking 10 minutes to get organized can keep everything on track. It's something I now do regularly to keep patient care and learning goals aligned. Question number 13. How has your education prepared you for your career? Residency programs want to see how well your academic training aligns with real-world practice. They're interested in your ability to apply classroom learning to clinical environments and how your education shaped your critical thinking, communication, and adaptability. My education gave me a strong foundation in pharmacotherapy, evidence-based decision-making, and collaborative care. In the classroom, I learned the why behind treatment decisions, but it was my rotations where everything clicked, like how to assess patients holistically and work with a care team to make practical recommendations. During rotations, I saw how drug knowledge connects with real-time decisions. I learned how to adjust recommendations based on renal function, patient goals, and even socioeconomic factors. One moment that stood out was managing anticoagulation in a patient with multiple comorbidities. I realized I had to balance textbook knowledge with human complexity. My education also emphasized documentation, communication, and professionalism, which I think are just as important as clinical knowledge. It's one thing to know what to do. It's another to explain it clearly to a team or a patient. That blend of structure and adaptability is something I'll carry with me into residency. Question number 14. What is your least favorite aspect of where you work now? This question helps programs gauge your ability to give honest but professional feedback. They want to know if you can handle challenges constructively without complaining or blaming. It also gives insight into what kind of work environment helps you thrive. At my current site, I've really valued the people I work with and the patient population. That said, one challenge has been the limited access to interdisciplinary team meetings. Most of the communication with providers is done through electronic notes or one-on-one consults, so I don't get as much exposure to the team-based decision-making process. I really enjoy that aspect of pharmacy, being able to sit with a team, hear different perspectives, and contribute in real time. When that's missing, it can be harder to understand the full picture or advocate for certain interventions. I've worked around it by proactively reaching out to providers and nurses to ask questions or clarify things, and they've been really receptive. Still, I'm looking forward to a residency where I can be more embedded in the team and grow from that daily collaboration. Question number 15. What do you think is the biggest issue facing pharmacy today? This question checks your awareness of broader healthcare trends and how they impact pharmacy practice. Residency programs want to know that you think beyond the textbook and are tuned into the challenges affecting patients, systems, and the profession as a whole. Your answer should reflect critical thinking and a patient-centered mindset. I think one of the biggest issues facing pharmacy today is the lack of provider status for pharmacists in many settings. We're highly trained healthcare professionals who can make significant contributions to patient care, yet we're often underutilized because of reimbursement limitations and legal barriers. This affects patient access, especially in underserved areas where pharmacists might be the most accessible healthcare providers. I've seen firsthand how much value pharmacists add, whether it's managing chronic conditions, adjusting therapy, or educating patients. And it's frustrating when those efforts aren't formally recognized. The shift toward value-based care is opening new doors, but we still have a long way to go in terms of policy and public awareness. I hope to be part of the next wave of pharmacists who not only deliver clinical care but advocate for the role we can play in improving outcomes. Question number 16. Have you done anything to improve yourself this past year? If so, what have you done? Residency programs look for candidates who take initiative and pursue growth on their own. This question shows whether you're reflective, self-motivated, and always working to improve your skills, even outside of structured rotations or coursework. Over the past year, I've focused on improving my ability to interpret clinical guidelines and apply them quickly in patient care settings. I realized during rotations that while I understood the content, I sometimes struggled to recall specific recommendations on the spot. So I created a personal reference binder where I summarized the most used guidelines, like for heart failure, anticoagulation, and diabetes, in a way that's quick to scan. I've used it on rotations and during topic discussions, and it's made a big difference in my confidence and clarity. I also enrolled in a communication workshop offered by my school to strengthen how I deliver recommendations to preceptors and providers. It helped me find a balance between being assertive and respectful. These small steps added up, and I feel much more prepared going into residency. Question number 17. Have you read any literature that's changed your life? This question gives insight into your values, mindset, and how you learn from the world around you. It helps programs see who you are beyond pharmacy, your curiosity, emotional intelligence, and personal growth habits. The Power of Now by Eckhart Tolle really shifted how I handle stress and uncertainty. It's not a pharmacy book, but it helped me slow down mentally and stay present, which actually made a big difference during rotations and interviews. Before reading it, I'd get caught up overthinking everything. Did I say that right? Did I miss something? But the book encouraged me to focus on what I can control and let go of the noise. That mindset helped me stay more grounded during clinical discussions and trust myself more. It also reminded me that presence matters in patient care. When you're fully focused on someone, not distracted or racing ahead, you build stronger connections and pick up on details you might otherwise miss. That's something I've brought into my pharmacy practice. Question number 18. If you were stranded on a deserted island, what 2 drugs would you take with you? This is a curveball designed to see how you think on your feet and apply clinical reasoning in a creative way. It also lets your personality come through while still keeping things pharmacy-related. I'd take acetaminophen and amoxicillin. Acetaminophen covers a lot of bases: pain, fever, headaches, and is generally well tolerated without needing much monitoring. On a deserted island, you're probably dealing with a lot of minor injuries or aches, and I'd want something reliable for that. Amoxicillin may not be the broadest spectrum antibiotic, but it's accessible, effective for common infections, and relatively safe in most age groups. If I ended up with a skin infection, dental abscess, or respiratory infection, it could be a lifesaver. Of course, if I had access to full diagnostics and supplies, I'd want something broader or more tailored. But going with versatility and safety, those 2 would be my picks. Plus, they're both oral and heat stable, which matters if you're stuck in the sun. And finally, here's the last question. Question number 19. What do you like to do in your free time? Residency directors want to know that you have a healthy outlet and can manage stress. It also helps them get a sense of your personality, interests, and whether you'll bring balance and positive energy to the team. In my free time, I really enjoy being outside, whether that's hiking, walking through a park, or just sitting with a book. It helps me clear my head and recharge, especially after long days of clinical work. I also enjoy cooking and trying out new recipes, which is a fun way to unwind and be creative. During pharmacy school, I made time each week to get outdoors or prep a new meal. It gave me structure and helped me stay grounded. I've learned that taking care of yourself helps you take better care of others, and that mindset has helped me stay present and focused during rotations. I also enjoy podcasts, especially ones about healthcare innovation and leadership. They give me a broader view of how pharmacy fits into the bigger picture of healthcare. It keeps me inspired and helps me think long-term about the kind of pharmacist I want to be. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.